Hello, my name is Dr. Buchanan, and I am a breast surgeon here at the Swedish Cancer Institute. By now, you've been told either by a nurse or a doctor that you have breast cancer. I know that this is an incredibly stressful and scary time. Over the next 15 minutes or so, I will give you a brief overview of the treatment of breast cancer. In addition, I'll give you some tips on what to expect during your first appointment. First of all, the treatment of breast cancer is a team effort, and you are an essential member of the team. First, there's the radiologist who identified your cancer by mammogram, ultrasound, MRI, or maybe it was something that you or your doctor felt. The biopsy that you had was read by a pathologist who generated a report outlining the details about your cancer. Usually the next person you'll meet will be the surgeon, whose job it is to remove that cancer in the breast and possibly evaluate and remove some lymph nodes underneath your arm. After the surgery is done, radiation may be required to decrease the risk of cancer coming back, and chemotherapy or anti-estrogen therapy may be recommended. In this case, other team members may include a radiation oncologist, who is the doctor that will be treating the breast with radiation, and a medical oncologist, who will treat the cancer with medications like chemotherapy or anti-estrogen therapy that affect the entire body. It seems like a lot of doctors, but we all work together with you to provide you with the best treatment options. Each treatment is individualized for the best possible outcome. Some patients require only some of the treatments, others may require or need all of them. Now let's get to the first appointment, which is typically with the surgeon. This appointment may take about an hour or longer. It usually involves taking a history of any medical problems, other surgeries, your medications, allergies, and performing a physical exam. It's a good idea to bring a list of medications and any allergies. Your appointment is usually a lot of information to take in all at one time, so it's very helpful to sometimes bring a family member or friend with you. This way, there are two sets of ears hearing the information. I also recommend that your friend might want to take notes that you can review at home. Sometimes the discussion can be tape recorded if the surgeon agrees. We try and leave some time at the end of the visit to try to answer your questions. In addition, we will give you some information covering the treatment of breast cancer and support services available here at Swedish and in the Puget Sound area. Once you've been examined by the surgeon and they have reviewed your information, other tests might be ordered. One of the most common tests we order is a breast MRI. Your surgeon will let you know if they think that this is an important test for you to have. Sometimes we order other tests to see if there's cancer elsewhere in your body. Depending on the situation, we'll also set up appointments for you to meet with a medical oncologist, a radiation oncologist, a geneticist, or a plastic surgeon. Each person is an individual, and this first appointment can be very overwhelming. We want to make the best possible recommendations for treatment along with your input. A second appointment may be necessary to review some of these ordered tests or to cover any questions which weren't answered during the first visit. The nurses in your surgeon's office will also be available to answer your questions during your treatment course. Often one of our nurses will come in to tell you about the timing of your tests, perhaps the timing of your operation, and what to expect before and after the surgery. Now, the way I think about the treatment of breast cancer is to start with the smaller picture and then expand it to the larger picture. For example, the smaller picture is thinking about how do we remove this tumor in the breast. That's what we call local treatment, which is usually managed by someone like me, a surgeon. The goal of local treatment is for me to remove that tumor and get a rim of normal tissue around the tumor, called a clear margin. This procedure is called a lumpectomy or a partial mastectomy. Once the tumor has been removed and there are clear margins, then a patient needs radiation to the breast to decrease the risk of it coming back. Traditionally, this is about 6 weeks of treatment, Monday through Friday. This plan of treatment, which includes performing a lumpectomy followed by radiation, is called breast conservation. Sometimes the patient may have a tumor that's too big for a lumpectomy, or there's more than one area in the breast involved with cancer. In this situation, it may be recommended to remove the entire breast, which is called a mastectomy. A mastectomy usually includes removing the entire breast, the skin that overlies the tumor, the nipple, and the areola complex. Radiation after mastectomy is only recommended in certain situations. Most breast surgery is done as a day procedure, except for patients who have had a mastectomy, who usually spend one night in the hospital. Once again, the nurse is a good resource person for you and can often answer a lot of questions about what you should expect over the next few weeks and address many of your concerns. Depending on the type of tumor you have, the surgery may also include a procedure to remove and evaluate a few lymph nodes from under the armpit. The lymph nodes under your arm area are usually the first place that cancer goes. Sometimes a large sample of lymph nodes are removed from underneath the arm, and this is called an axillary lymph node dissection. The other way we evaluate lymph nodes is to do a procedure called a sentinel node biopsy. We're able to locate the closest nodes to the tumor by using a special dye and radioactive material. If no cancer cells are seen in the nodes, the surgeon doesn't have to take any more. Once surgery is done, the tissue from both the breast and the lymph nodes are sent off to our pathologist. The pathologist will then examine everything underneath the microscope and in a week or so be able to give information about the size of the tumor. Depending on whether the cancer has spread to any of the lymph nodes and if the margins are cancer-free, then the surgeon will go over the results with you at your visit after surgery. Although the tumor has been removed, there's still a chance that microscopic cancer cells could be elsewhere in your body. The medical oncologist is the team member who will be talking to you about treatments to treat your entire body. Most of the time, the recommendations will be made after surgery is complete because the information from the pathology report helps your team recommend the right treatment for you. Treatment may be chemotherapy in some cases or an anti-estrogen pill. The most important thing to remember is to take each part of treatment step by step. There are a team of people to help you and your family through this process, from your doctors to our nursing staff, physical therapists, and social workers. Once treatment is completed, your medical team will want to keep in contact with you. We will want to do a physical exam and make sure that we are imaging your breasts very closely. You may be seeing your surgeon, nurse practitioner, or your medical oncologist every 6 months or so, depending on your situation. The time after treatment is finished can be a very difficult time for patients. Sometimes patients say they feel at very loose ends, and they miss the security and such close contact with their treatment team. This is a time of transition, and we have survivorship programs to address these issues as well. Thank you very much for listening to Swedish Cancer Institute's podcast in the breast cancer series, What to Expect When Diagnosed with Breast Cancer. For more information on breast cancer treatment, please contact your physician.